Hello everybody, I'm Fiona Clark. I'm here today with my lovely co-host, the Dr. Clare Kiely, consultant dermatologist, and you are listening to Skin Aging Unlocked, the podcast from the Skin Diary. And today we are talking to Dr. Angela Tewari, who is a consultant dermatologist and a consultant paediatric dermatologist as well. And we are talking about teens, tweens and sun damage, because you can never get away from that. Now, if there's anybody who's marketed to on this earth at 1,000,000 miles an hour on every social media platform on earth, it is teens and tweens. I can understand that, fortunately my child has grown up, but I could understand there'd be an awful lot of pressure on any parent, anybody between the age of 8 or 16 who has a mobile phone saying, I have to have. Are these the sorts of things that you actually see when parents turn up in your clinics or with smaller children especially?
For sure, because primarily patients or parents of children don't know. They want to do the best by their child. The child is telling them X, Y and Z. They can't make a decision which product is good, and so they're following their children. But really what we need to gear this for is understanding of what actives you can actually have in childhood, in your tweens, which is a number of things that you can't have, and really focus, so that you understand what a child needs regardless.
Yeah, I think the thing is that the children are being marketed to so that the parents buy the products, and the children are being marketed to very, very well because they're coming home and demanding it. And even if your child isn't watching these things, they're hearing it from their peers. And, let's be honest, we all love, lovely, shiny, sparkly, pretty new things, and children definitely do. In our day and age, it was the little smelly stickers that we used to get, and stationery. That's what we were all obsessed with. But now it's skincare. And the thing is, I think just reeling it back to what do they actually need, what is good for their skin
and
long term,
why as well, really.
And why, yes.
Because you have the skin cycle, let's think of it like that. And in babies, you rejuvenate or renew your skin within 14 days. So the cycle of where the skin is then shed, it's 14 days in a child, 28 days, for example, in an adult. A bit more as we get a bit older. And we know that because we get a surface of dead skin cells as we get a bit older, and that's that dull, dry complexion. The light is bouncing off in a way that it makes it look less shiny and bouncy. And we're all chasing that baby soft skin. But as a tween and as a teenager, your cell cycle renewal process is still very fast.
Yeah.
You don't need to speed it up even more with acids or retinols.
Yeah.
Or
Absolutely.
even
their skin is beautiful and plump
like
and
vitamin C.
healthy.
Exactly.
So really, they really just need the basics. And then whatever else that they might want might be just a little additional treat, I think, on top. But we really need to reel it back into what is the basic skincare needs. And it differs between, we say the tweens are the kind of preteens, so the 8 to 12-year-olds, and then teenagers, basically once your hormones start kicking in and puberty starts kicking in as a teenager, your skin
acne.
does change a little bit and you have a tendency to pimples and that. So pre-puberty, we like to keep it very, very simple.
And is that because it's actually, you said the skin turnover is much quicker, but when babies are born, their skin mantle is really quite fragile, isn't it? At what point do we get to a point then when it would be safe to actually say, if they're coming home and saying, I'm going to age terribly if I don't have a retinoid in my skincare range at the age of 8.
Children need a sunscreen. So you need to protect from harmful rays from sunshine. And, children are active. They're going to get their vitamin D production with a sunscreen on if they're outdoors. Within 5 minutes, you get sufficient vitamin D production if you're outdoors for 5 minutes at, say, midday. If you're outdoors for a bit longer with sunscreen, you're going to get ample amount of vitamin D production.
Yeah.
So
their skin is replete with all of these vitamins and nutrients. If they have a decent diet and you're trying to, feed them as much vegetables and fish and everything as you can, there's absolutely no need to be putting extra vitamins onto their faces. No need. It's all about just keeping their barrier intact, gentle washes, some moisturizer if they need it. And as Angela said, obviously you're talking to two dermatologists here who are obsessed with UV, love the sun, but obsessed with UV damage, and an SPF is essential. Getting an SPF onto your kid is tricky. However, there's some beautifully formulated ones now, but we can talk about some tricks to that.
Yeah. You mentioned in there putting vitamins on children's skin, and vitamin C and vitamin A and things along those sorts of lines. Is there any chance then at that age that putting them on could actually do more harm than good?
definitely. So vitamin C, we know for us will brighten our skin, can help decrease pigmentation, can enhance collagen production. You don't need any of that as a child. Your skin is bright. It's going to be glowing because it's smooth and shiny. You probably won't, well, you won't have an issue with pigmentation at that age, and your collagen is being produced into your 20s. So the idea of vitamin C is not necessary in your preteens or your tweens. Even acids, for example, so your alpha hydroxy acids, and we'll come on to beta hydroxy acids like salicylic acid. It's such a big market. I was reading it gives billions of pounds to the beauty industry. But the aim of that is removing those dull skin cells. So that rejuvenation process, which is very quick in children, much quicker than in adults, to help enhance that. There's no need for it.
Yeah.
So,
yeah. And if anything, their skin is quite delicate, and some kids, especially those with sensitive skin or those who have a history of eczema, if they're putting products that are too harsh on their skin, you're just going to trigger those sensitivities. So using products that are gentle and mild and not those that are formulated for adult skin or for aging skin is really the key, especially in that pre-teen area. There are certain things that once they become teenagers and are slightly more prone to acne that they can use. But in the preteen area, really, it's just the gentle products. Things like vitamin C are formulated at quite an acidic pH. If they're using things like that all the time, that can cause problems. I've got 3 little ones, as does Angela. Angela's got 3 boys. I've got two girls and a boy, and recently, the 2 girls, the 4-year-old particularly, has started saying, "Please, can we have a spa day, Mummy?"
sweet.
But spa day just entails her wanting to put, the cucumbers on and a mask. So, because she was incessantly asking for it, I kind of thought, okay, what's the harm? So found some products that had absolutely 0 active ingredients in them. So you're just talking about basically me putting like a moisturiser on her and going, that's a mask, and then the cucumbers just for a minute.
And in my clinic, mums do ask me, what product shall I use? And I have 2 things that I say you can use. Niacinamide and actually salicylic acid, which can be very good for acne at up to a 1% concentration. 1 or 2% is really all you need. And those are the 2 acids. Then you have hyaluronic acid, you have all sorts of other things. But in terms of actives, I'm happy with niacinamide and I'm happy with salicylic acid.
But that's more in the teen sort of, in a tween, in a younger one?
So, yeah, I mean, it's starting at a younger age, definitely with girls. And, my boys at age 12 and 10 are probably not there, but, my son's very much like, can I sell all this skincare? So there's definitely at school an interest in all these different products. Yeah. But really, low-dose niacinamide is
It's
all.
very entrepreneurial.
Like, don't sell it, you're going to get in trouble.
Good on him.
I mean, whether they, things like the niacinamide and the salicylic acid really are for, they're starting to get little pimples and breakouts and things, or you're seeing that under the skin. As regards, the younger kids, definitely just gentle cleansers and washes. The other thing is this whole issue of skincare that is packaged brightly with a view to the kids wanting it and coveting it. And we know there are a couple of brands that do that. And that was some of the questions that I was asked for this podcast by some of the lovely parents that I asked to send in their questions, was about, are some of these brands that are marketed for children better than your standard pharmacy bought products? And really the answer is no, probably not. The simple kind of pharmacy bought brands usually are very bland, don't contain many active ingredients. Things like essential oils and skincare can be irritating for certain people.
Particularly if you've got sensitive skin.
Particularly if you've got sensitive skin. And some of these products, as soon as you smell them, they have all these lovely essential oils in there. I think these kind of things are fine every now and then as a treat. Little Christmas present from your auntie or whatever, but not as your regular day-to-day skincare.
But you can see how a product that's brightly marketed with many different colours, as opposed to another product that's sold as, say, black and white product that may be more boring, you can see where the eye is going to go.
Yeah, absolutely.
But I think definitely focusing on what actives you shouldn't really be having, and those are the retinols, retinaldehydes, the alpha hydroxy acids, so your glycolic acid, mandelic acid. You don't need those.
And harsh kind of scrubs, things like that. They definitely don't need those.
We'll get to them for the teens. I would imagine also in this younger age group that these brightly packaged products probably have an awful lot of fragrance in them of some description. Can that be damaging as well?
I mean, so the fragrances are usually kept to the minimum. Now, a lot of companies will use essential oils as their fragrance. So when you think of essential oils, things like lavender. And it really depends, because they are formulated to be very safe. It really depends on the person. It's the same as with adults. I mean, some people's skin can just take it, and essential oils is not a problem for them, and they can use all these kind of fragranced skincare with all of these things. But if your child has sensitive skin, then that's absolutely not the thing to be putting on them. Again, just talking about these kind of face masks and things, I mean, a lot of those are like that. They're kind of packed with active ingredients for adult skin. That is not the kind of thing to be putting on your little one. It's tricky, but I would say stick to the minimalist skincare brands that we know and love.
But it's interesting you say that about fragrances, because we know that in terms of a contact allergy clinic in dermatology, your more lemony type fragrances, so they have names like hydroxyperoxide of limonene and limonol, the more sort of lemon type smells are more likely to trigger an allergic event. Do I see that so much in children? Probably not so much now, but perhaps with the advent of these products hitting the market so much, we may be. So I think that's a really good point. Definitely in adults, fragrances is one of the biggest face allergies we'll see in clinic.
Yeah, and I would imagine a lot of those sort of cheaper sort of supermarket brands and things like that would be very, very smelly and very, very containing a lot of things that would probably not be very nice.
Yeah, so some of the preservatives as well at high doses can be quite irritating on the skin.
And I'd imagine too they probably have quite a lot of alcohol.
Yeah.
I mean, there
Some
are some
products
good
will.
alcohols, aren't there? And then there are some bad alcohols, but drying alcohols.
They're usually, once they're at a low level, it all depends on, the dose makes the poison with everything. I mean, some of the fragrances are even at such a low level that they don't have to say that they're a fragrance, but they're in there. We often see the limonol and limonol in fragrance products. But yeah, in children's skincare, best to keep it at a minimum. Also, there's this whole thing of layering. I don't know if you've seen on TikTok, you have these little mini influencers. And sometimes my 10-year-old will go in front of the mirror and start talking to herself. And I'm like, what are you doing? Who are you talking to? And this is what she's doing. She's emulating like a TikTok video. But, there's all this stuff about layering products that I wouldn't even get an adult to do.
So what is your daughter layering products? Which ones?
No, she's just literally she is in pretend mode because she doesn't have these products. She literally is taking the CeraVe or the Simple and pretending to do it just for fun. But this is what these little mini influencers are doing. And
but they're obviously taking, not just hyaluronic acids, but different types of almost peeling agents and so giving them the idea where it stems from, right?
Yes. Or seeing their mums do it, I guess, and seeing mums with a very complex skincare routine and then trying to copy mummy, which is why one of the reasons I actually, I try not to let the kids see me, even putting my makeup on. I try to go into another room. I don't want them getting that appearance obsession at an early age, because I think that's probably one of the other issues with this, is not so much the skincare, the expense of it, and the fact that you use too much of it, it can cause irritation. It's the kind of appearance obsession that can evolve into just from staring at yourself in the mirror and looking at all these minor blemishes.
Because we see in older people quite a lot dysmorphia as well. Are you starting to see that kind of, I hate myself in younger children?
I mean, definitely when it comes to mental health, we know that the advent of looking at yourself, assessing yourself through video, through times when in 2020, when there were things much more done on video with COVID, there is a massive element of that. And it's starting younger.
Yeah.
But I do think things will change. There's more bans now. So, for example, my son's secondary school, they are implementing bans after school, at least one day a week anyway, where they're not allowed to have phones.
That's great.
And I think we're probably going to see more of this, people getting more aware.
Yeah, it's the problem with this idea of perfection, isn't it? And the perfect skin complexion, this even notion of glass skin that drives me bonkers.
Dare I ask, what is glass skin?
Oh, it's just absolutely perfect, poreless, shiny skin that just doesn't exist.
It doesn't exist.
In
with a
reality.
filter, it may do.
Yeah.
But then, it's implemented as put an acid on to break those bonds down and make the dry skin cells go away. Then add your hyaluronic acid. Then add another serum. Then spray your skin. And yes, an element. If you put a lot of products on, your skin will look shiny. Yeah. But you need to have one or two right products or hero products in adults, in tweens, and preteens, and that's literally all you need. But there is that feeling that the more you put on, then your skin will be beautiful and glowing.
Yeah. And then actually you're probably leading into more problems when they're, as they get into teenage years, if they're putting layers and layers of products, they're just blocking everything. But I think back to the kind of appearance obsession, I mean, because I do a lot of lasers and acne scarring and I do some cosmetic dermatology, I see a lot of appearance dissatisfaction, even from kind of minor acne scars. A lot of my laser clinics are basically hand holding and explaining to people that we can't just make their scars vanish, and actually that everyone has imperfections. I mean, I think teaching our kids that normal skin has imperfections and bumps and pores and little bits of acne every now and then, and that is completely normal, and not to chase this idea of perfection, because you'll never get there and you'll end up being sad.
Especially when the person you're looking at, as you said, has probably put 15 filters on themselves. But
it's interesting you say that, because absolutely in my paediatric dermatology clinic, I will tell girls and boys that 90% or 95% of you will have acne at some point. You know, it's so common. Yeah. And the 10% or 5% that aren't, you know, they haven't hit puberty yet. Yeah. And you're very surprised to see their response. Very much, no, but really? I'm like, absolutely, this is normal. Yeah. You know, the element of normal is really important to bring that home.
Yeah, that it is totally normal, and it is a normal part of kind of going through puberty. Obviously, there are little things that we can do to help, and if it gets to a stage when it gets very bad, there are GPs and dermatologists who can help. But I think the thing with the parents, as it always comes back to being a parent, is this parental guilt. And what I'm getting the feeling of among the kind of tweens group of parents is that they're trying to do everything that they can to prevent their little ones from getting acne, whether that's using the right skincare, giving them some vitamins, stopping them from playing too much sport or washing after sport. You know, what can they do to stop it from happening? And it's like that. Sometimes you're just not going to be able to stop it from happening. It's just going to happen because it's a normal part of the hormones and puberty. But I think that might be sort of also what's driving this industry. Yeah.
It's tricky, isn't it? Because as a parent, you want to do well by your child.
Yes.
And if you don't know any better, you see that they're happy, you see their friends are happy with X, Y, and Z. So you want to do that as well. Yeah. But also what I'm seeing in clinic is if you use too many actives, I'm seeing perioral dermatitis, which is a disruption of the skin barrier. I'm seeing that at an earlier age. So I've seen 16-year-olds with that. Yeah. And that's really uncomfortable. And that's using too many actives in one go, disrupting how the skin should behave as a protective barrier, and then being more susceptible to certain facial infections or types of sort of bumps that look like rosacea. So more harmful.
Are you seeing more teenagers that are little mini skincare experts because they've done so much research on the and they'll come in and they'll say, I'm using my niacinamide, I'm using my vitamin C, and they're using all of these things, and you're like, whoa.
And the mum is learning from them as well, and I'm there like, no. But you can get caught up in it, and initially it feels like it's a good thing to do because you're not watching certain TV programs, you're not playing on or gaming online, but this has its consequences as well.
I suppose for the tweens, we could talk about, we've talked about the tweens.
But actually, before we move on to them, the other thing about that is that when kids are quite young, parents are just going to the sun damage before we move on, that is freaking out and going, well, I don't want to put sunscreen on with all of these chemicals and all of these horrible things on a small child. What can they do about
answer that one.
Yes.
You go, girl.
Yeah, so, I mean, this comes into that whole realm. I get that a lot, you know. I don't want to put chemicals on my skin, and I don't want to give the kind of very kind of pithy answer of, well, everything's a chemical. I think what we have to understand is that this whole world of clean beauty is really not something to buy into. There is no such thing as clean and dirty. When it comes to product ingredients, it all comes down to the science of toxicology, which comes down to hazard and risk. And where there is hazard does not mean that there's risk. And that concept itself is actually a lot harder to understand than clean and dirty. So I think that's why people kind of go down the clean and dirty route. But basically, please don't follow this whole notion of clean beauty because it's absolutely a load of rubbish. The ingredients in your skincare, and especially in sunscreens, are very heavily actually tested and regulated for safety. And the people that do that are scientists called toxicologists who have done loads of specialist training and dedicated their careers to understanding all of these chemicals in skincare ingredients. You know, they're not dermatologists, they're not epidemiologists, they're toxicologists. And toxicologists basically will test every single ingredient to the nth degree to make sure that it is safe. I have to say, I love Michelle Wong. You know Michelle Wong. She's a science communicator.
Oh, yes,
but I think
yes.
she explained it really well. I remember hearing her say about these toxicologists that you have to remember that they are also people who have children and husbands and wives and sisters and grandparents, and they don't want them putting on creams and products on their skin that could possibly be harmful. The people behind this are testing your ingredients are people. And they have researched the studies. If you read a study and you think, oh, it's a dangerous ingredient, they have researched it to the nth degree. So, I mean, I'd love if we could get a toxicologist on here someday to explain it, because it's really fascinating. But I think people worry about that. So basically, they have been tested to be safe on pregnant women and children. Using sunscreen is so important for protecting your child's skin from UV damage, which can cause long-term problems. Look, we're never going to be perfect and get it on them and, you know, block every single UVA, and we don't want to do that. We want our kids to be outside and enjoying the sun and getting their vitamin D. But that was a very long-winded way of saying that, yes, sunscreens are safe.
Yeah, I mean, definitely I can't wait to hear what toxicologists bring on next time. But the concept of mineral filters and chemicals being these absorbing molecules that then change and can be bad for your skin, we now know we have stable filters. You've got Triazorb, which is a new filter that's come out. You've got Tinazorb, you've got Mexoral in a number of products, and they are very stable. And the whole point is that they absorb UV, so it doesn't go into the skin. And you've got zinc, titanium dioxide, which are, being certain metals, are thought to have issues, but really when you look at the data, it's very safe. And from the age of 6 months, I'm very happy for children or babies to have sunscreen. Yeah. There's an element of really thinking about protecting your child if they're younger than that, so with an umbrella, with a hat. And I think that's primarily, from my understanding, is that the data is a bit minimal with use of all these sunscreen. Yeah. But I put sunscreen on my 4-month-old.
Yeah, you know, exactly.
Not every 2 hours, but I have. And, you know, if I'm going to take him outside, there's no problem with doing that on an ad hoc basis.
Yeah, I mean, obviously, you know, the sun protective clothing, if you're going on your sun holiday somewhere really hot and sunny and you're going to be outside for prolonged periods, you know, if you can put sun protective clothing on them, I get mine to wear them, you know, the rash vests. That's obviously so much easier than having to layer lots of sunscreen on, because it does just kind of, you know, they'll go swimming and it'll wash off. This, again, it's the fear of causing harm to your little one. I would really try and trust the expert toxicologists, and we have no evidence that there is any harm with these sunscreens.
Absolutely.
All right, let me sum up the tweens then. So we've got, you don't need actives, you don't have to worry about them worrying about getting old, preventing acne is too early for them, and just use things that are mild. And just if we're looking at things like, you mentioned CeraVe there, are there, you know, if they do, especially like, I mean, you know, I'm a pale rosacea prone kid and my skin was always dry even when I was very little, and I grew up, you know, close to the Antarctic. Are you safe to put something that is like a CeraVe or just something that has no sort of fragrance in it on a little kid who might actually be dry or eczema prone?
Yeah, I mean, there are a number of products. There's Tropic, there's Aven, there's La Roche-Posay, number of these from French pharmacy, number of the products that I think the main aspect is understanding that you don't need actives. You don't need your alpha hydroxy acid or high dose salicylic acid and a retinol. So you don't need any of those.
Gentle cleanser, moisturizer if it's needed.
Would you go for a cleanser for your children?
Simple.
Yeah.
See, I would never have even, you will probably be appalled, but when I was 8, I would never have even thought about washing my face unless I'd got mud thrown on it.
Yeah, I think...
it's interesting how times have changed.
Yeah, seriously.
I mean, I think probably once a day in the evening for kids is enough, unless they're quite sporty and need to, you know, maybe twice a day for that age group. But yeah, I think a gentle cream or foaming cleanser from any of those.
Well, my boys will wash their face in the shower once in the evening.
Perfect.
And with their faster turnover, their skin cycle, shall we say, I'm very, very happy with that. If I can get a sunscreen on them, please wear a sunscreen.
Yeah, it's just tricky. I mean, it's not
tricky.
actually, it's not the chemicals in the sunscreen we should be worried about. It's just trying to get the sunscreen on them. That's actually hard.
I still
But
have difficulty
mine,
getting mine onto my husband. So there you go.
They don't change.
No, they don't.
Yeah.
Right. Then you hit teenagers. Those hormones change. The zits start. Everybody, as you mentioned before, goes into a flat panic. What do we do?
So I love benzoyl peroxide. It comes in a number of products, so it really depends on, shall we say, flavour of the month. At the moment, it's 5% acne side. And benzoyl peroxide really hits hard at one of the pathophysiological processes of acne. So it helps to reduce down the bacterial load. And that's your cutis bacteria. You've got sebum, so an excess sebum production or oil production. That is all very much hormonally controlled. You've got inflammation and blocked pores. But with the sebum, what is really good is a prescription-based, dermatology-guided. So ideally, if you can see your dermatologist, and it's starting something like retinoic acid. And I'm very particular about concentration. It'll be good to hear what you think, Claire, or what your thoughts are. But I go for a 0.025% cream, and it needs to be 2 to 3 times a week only. And that's for acne, on all acne-prone areas. And that's to reduce that sebum load. And those are very, very helpful products. To help with reducing or opening up those pores, so unclogging pores that you get with acne, a salicylic acid-based wash. And really all you need is a 1% salicylic acid wash. So those are the small concentrations that I like.
Yeah, I mean, I think there's kind of like a tier, isn't it? Yeah, there's the benzoyl peroxide, salicylic acid, and then the retinoids. They're the 3 things really for the kind of more acne-prone skin. Probably gets a bit difficult when you have teenagers that have sensitive skin and acne-prone skin, because a lot of the things that we use for acne are, a bit drying and a bit sensitizing. But it's all about that kind of intermittent dosing, really, isn't it? And even as a parent, if you have a kid that you think their skin is a bit acne prone but also it's a bit dry, you can do that. You can do the salicylic acid wash, but just do it twice a week. Use the benzoyl peroxide just in specific areas and not everywhere. I remember being a teenager and just wanting to get rid of the spots and just lashing on the benzoyl peroxide.
That's right. So it's
there'd be
always
so many
dry.
kids with the dry red peely
So
faces.
it flakes off. Yeah, no, absolutely. And also it's okay to use a moisturiser. So you add, you need to replenish that skin barrier. So that's the top layer of the skin that needs certain, what we know as ceramides, urea, so certain sort of fatty acids. So it's important to have a moisture base to your products. And there are some that are more likely to be sort of oil prone and blocking, and those that aren't. So any products that say, there's Toleraine by La Roche-Posay, Aven do a great range. A moisturiser is fine.
Yeah.
See, a lot of people sort of go, but if the skin's oily, I don't want to put anything on it that's going to do that. But the truth is exactly the opposite way around, really, isn't it?
You need a nice light moisturiser will be perfect, because if you dry out the tendency I find with patients with acne is that they want their face to be squeaky clean. So they'll really try and dry it out. But actually then you're kind of sending messages to the sebum producing glands that there's more sebum needed. So, you might actually be counteracting the problem actually by drying yourself out. So gentle washes. I mean, I think, every dermatologist probably on the planet tells kids to use Cetaphil. I mean, it's like one of those.
Yeah, for sure. I grew up on Cetaphil.
Yeah, and I mean, it's pretty basic, but that kind of keeping it gentle does the job. Little bits of active ingredients, depending how bad the problem is. And then if you, as a parent, don't think that you're in control of the situation, pop to your GP. I think people get worried that the GPs are immediately going to put their kids on, things like Roaccutane. But there's lots of other steps before that.
Absolutely.
There's lots of topical prescription creams, lots of... And even if it's antibiotics, don't worry, it's for a short period.
And acne is not dirty skin. It's so important to know that if you've got acne versus someone that's not got acne, you're not doing anything different with your hygiene. There's an element of diet association, but really at that age, it's important to keep that varied diet. And if you enjoy and you want to divulge in fatty foods, that's absolutely fine. You're not doing anything. You're not causing the acne problem. And that's so important that your
Yes.
teenagers, your kids.
We don't want to
understand
create
that.
any fad diets
Absolutely.
because kids will tend to do that for themselves, even, because their friends might tell them, oh, it's because of
No,
the chips
exactly.
or
It's your fault.
it's your fault.
Yeah, look at you eating all those sugary foods, eating the
Yeah.
cake.
Yeah.
I stopped having milk and therefore it went away. There are
Yeah,
so
yeah.
many of those sorts of things. But basically what you're saying is just keep a good, healthy, varied diet. And if you happen to have something regarded as crappy every so often, it's not really a big problem.
Exactly. I mean, there's papers with association with dairy resulting or causing an increase in papulopustular acne, having a decrease in sugar. So sugar is obviously pro-inflammatory. If you remove that, you remove gluten, you improve your skin. But in terms of the quality of life, in terms of, when you look at their happiness scores, it's a real important to weigh that up. So for sure in children, I'm all about eat 5 different colours a day. And I think that's important to focus on that and not focus so much on the chips or the fish and chips that they had on the way back from school.
For so many aspects of their health. I mean, again, coming back to the vitamin D question that we get asked all the time, you can get vitamin D from things like eggs, egg yolks, oily fish. Obviously trying to get your kids to eat salmon and mackerel and sardines is a bit tricky.
Fish pie.
But sometimes my little guy has a penchant for the sardines. So
very good.
sometimes,
Let me know how you manage that.
But I think in the winter time, I would always just tell them to take a vitamin supplement anyway. I mean, and that's not because of sun avoidance. That's just because all of us are low in vitamin D in the winter. But just the varied diet and not focusing too much on one food group is essential in that era of teens and tweens who are so appearance obsessed anyway. You just don't want to give them any other reasons to focus too much on themselves.
I agree with the vitamin D. I've got these lovely jellies that another mum friend told me about. And they're like having gummy sweets or Haribos, whatever.
Yeah, that's
and,
exactly what mine have.
Pop 2 a day,
Yeah.
so that's 400 international units each with
Yeah.
each tablet. 800 international units a day for the children, definitely over the winter months.
Yeah, this is what we use as bribery for them to
Yes.
get dressed in the morning. Hurry up, their little jellies are waiting for them at the door. So once they're ready and have everything done,
The only problem
they
is that
get
my
one.
2-year-old's spotting this, and it's like, nope, that one's not for you. Yours is the other boring
Yes.
sort of.
Yeah, and the only other problem is them not. You have to lock them away, or else they'll have just down the whole
They're
lot.
quite Moorish, I must say.
Now, you mentioned squeaky clean before. The other thing that teenagers get horrendously upset about is blackheads. And they will scrub and scrub and scrub until there's virtually no skin left. And they also think, as you said before, that acne is not a result of being dirty. So what is a blackhead? Should they be using those harsh scrubs, or how do they get rid of them?
So, blackheads. So that is essentially a blocked pore with skin cells in it. So keratin blocks these pores. You have blackheads and whiteheads, and they look unsightly. And I love picking my skin. I'll put my hand up. Most people are pickers. That's why we like all these programs.
Dermatologists are pickers.
And what do you do for them? I think it's very difficult. I think it's absolutely very tricky. Have I seen many kids? I've seen kids or teenagers with the odd blackhead. Multiple blackheads, I'm going to give them Roaccutane. There's medical treatment for that. The odd blackhead, you can use a topical retinoid. You can try and increase the surface turnover in acne. So not for any other reason, but definitely for acne, there's an element of trying to use a topical vitamin A product. But I think it's quite
The
difficult.
things we spoke about, the salicylic acid
Yeah.
and the benzoyl peroxide can help a bit.
Because it's going to scar those.
Yeah, and you definitely don't want them picking. There is this thing in dermatology called acne excoriae. So it's when we see people come in and they have acne, but it's all just little picked blemishes and post-inflammatory pigmentation or redness. And, that again comes from that obsession of kind of looking in the mirror and checking out all the little blemishes.
And your acne marks will be not just circular areas, but almost, we could say linear, so almost like as if they have tried to pick it. And it's a habit that so long as we talk about it and we say that this is what happens and you bring it into your conscious, so we say, because often you'll pick without realising it, then I think it's important to talk about it.
Yeah, you can get these little hydrocolloid plasters,
that's
these little
right.
zipped plasters now, which are quite good actually.
Yeah.
We like hydrocolloid dressings in dermatology for many reasons, but these kind of with the little whiteheads, they kind of tend to draw them out.
And by
soothe the
putting a
skin.
plaster there, it stops you from reaching to your skin.
Yeah.
Which I think is actually that element of protection is so helpful.
Yes, I remember watching a lot of my son's teenage girlfriends with all of these things plastered all over
Yeah,
their
I
faces.
love that because it's kind of like it's normalised and they're like, yeah, it's
Exactly.
just my zip plaster. Who cares? You know,
I
that's
can't
that's
get
great.
at it, so and you can't see it, so
Yeah. And anything, I guess, that, avoids that sort of risk of scarring too, because you really just don't want to end up with that.
Yeah, I mean, that is the thing to remember, that you can get all these topical over-the-counter products and you can get advice from your pharmacy. But if things get a bit out of control, do seek help because we have lots of great treatments.
absolutely.
We do want to try to avoid the scarring because it's tricky to treat down the road.
And if you do have acne that's affecting a large part of your face, it's nothing you've done. There are so many treatments available, and let us help you as dermatologists or even any health professional. You don't need to avoid everything in your diet. We can give you medications, and it's okay to have medications. Some people get it worse. There's a genetic component to it. So if a parent has had very severe acne, so for example, my father had very severe acne, I had acne that needed medical treatment, and it's okay. So and I think normalising that process as well, that you can get, there's so many treatment options is important to get out there.
Yeah.
Then we get to the tween, or the teen, who is sort of probably more 15, 16, 17-ish, and they're starting to worry about the development of wrinkles and ageing, because we still live in a society where we are so anti-ageing, unfortunately. Is there any benefit in them having any topicals for the prevention of wrinkles?
I've got one answer.
Me too. No. Like, just no.
You're producing collagen into your 20s. It's not until your late 20s that actually the amount of collagen that's produced in the skin starts reducing, and that too by a minute amount. So really there's no need.
I think, because hopefully as dermatologists and even the skincare industry we've really spread the notion of sunblocks and the fact that UV is what causes damage. I think that probably a lot of the teenagers and kind of 20-year-olds now do realise that it's all about prevention. I mean, for collagen banking, as they called it, which is the term you introduced me to, Fiona, the best thing for collagen banking is an SPF. That's it. I think that is really the mantra to give those older teens who are thinking about things like that. I have been asked by parents of, I wouldn't say maybe teenagers, but, still kids in their early 20s, if they should be having preventative Botox. And the other big answer to that is no.
Back to your topic of SPF, so your sun protection factor. I mean, that is primarily protection against UVB. And we know UVB is highly active. It's ultraviolet radiation B, but it only makes up a very small proportion of the ultraviolet radiation that reaches us. It's only 5%. You have also UVA, or long wave UVA, and I will come on to some other aspects of that. But what's really important is that you also protect against UVA, and that's looking at broadband sunscreens. So protecting against your more pigmentary response, the part of the ultraviolet radiation that will go deeper in the skin.
Yeah.
You must protect against UVB. That causes sunburn, and we know sunburn is important to reduce down those number of episodes more for a long-term basis.
Yeah.
But a broadband sunscreen
That's
is really what we're looking for.
I think a key thing to note is that looking at the products, they should say UVA and UVB, broad spectrum protection, because we all kind of get caught out sometimes, I think, with the moisturisers that contain an SPF of 15 or 30, thinking that's enough. But actually it just might not have UVA protection. So just to check that. And I suppose for parents, that's an important one. I just remembered something that I've gotten, which is a thing called a solar buddy. Okay. And I don't work for this company, but I got these from Amazon. So the problem I've always had with the kids on sunscreen is that the sunscreen, if you give it to them and say, put on your sunscreen again in the morning in a bit of a rush, you turn around and they're like white and they've got sunscreen everywhere, and it's a big mess because they put a big dollop on. And
Great.
I
think that's brilliant. My boys wouldn't go anywhere
No problem
near
with that.
You then have to go, okay, give some to me, share it around. But there's these little things that you can buy on Amazon called solar buddies. But you open them up and they come in lovely bright colours, which the kids love. They're kind of kid-sized. You squirt the sunscreen into them, close them up, and basically it's like a little roller ball and a sponge.
Brilliant.
So
good
they
idea.
can just, and they're, I mean, when I got them for my 3, the excitement. They were just so excited to have this new little gadget that they could use, and now they're happy to put it on, and they can kind of fling it in their sports kit.
That's brilliant.
Those little things, it's probably
Little nifty ideas, or a spray sunscreen is great actually.
Yeah.
Though I hate the sprays.
Do you?
I really hate them. I'll tell you why. I'll tell you why I hate them. Because when I go to the beach, all I do is get mouthfuls of somebody else's sunscreen in the spray. And then I'm looking and thinking, did any of that actually go on your kid? How do you know that you've actually got a good enough coverage?
I think the
and that's the other thing that goes
sometimes
with the,
just maybe blow away.
Yeah.
But the spray, if you're inside, they're really, really handy for kids. Because you can just literally go zip, 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 and it's
And they
done.
don't feel like they've got too much.
But how do you know if you've actually got
Enough.
a reasonable enough coverage? And that comes to the moisturisers as well.
Yeah.
Because when you say you've got to put on your sunscreen, it's got to be a tablespoon for this part of your body and a teaspoon for that part of your body.
No,
And
absolutely.
if you just go, are you actually getting a decent coverage?
I mean, the papers are, in terms of looking at the sun protection ratios for UVA and UVB, it's 2 milligrams per centimetre squared. So that is basically looking like a white cast, is essentially the papers. Realistically, is that possible? No. So you are really going to get a quarter of whatever is on the bottle. So if it says SPF 50, high UVA protection, you're going to get a quarter of that, which is 12.5. Unfortunately, that's the truth. But I would rather get 12.5, protection factor for my child, who would be happy to use it and reapply regularly, as opposed to not letting them let me use it. So I'm okay with that.
Yeah.
So being applied on the skin that feels like it's not enough, but you've put something on.
Yeah.
And as opposed to, oh, Mum, it's really, really white. I look awful. I don't want to wear this. It's in my
or
eyes.
it's sticky. Or, I mean, that's another thing. Like, thankfully now, because we have all these lovely new filters, we have some great sunscreens for the acne-prone teenagers. There's like these light gel formulations. So there's something, I think, for everyone. It's just a matter of
finding
your choice. Yes.
But I agree, it's so hard. And, sprays for us as a family with the boys, if I can hold them for like 10 seconds to get the product on, I'm all there. Yeah. But it's not for everyone, right? So, and I think that's exactly that. You've got products for each skin type.
Yeah. And is it... People, when you mentioned SPF 15 or SPF 30 or 50, people often look at that and go, oh, well, this is a stronger sunscreen than that one, but it's not. It's the length of time you can stay out in the sun. So does it really matter if it's a 15 or a 30 or a 50?
I would say yes. Primarily because in my head it's if you're putting on an SPF 15, if you divide it by 4, you're only ever getting an SPF or a protection factor of 3. So it doesn't mean that you can be outdoors 3 times longer than without a sunscreen. It just means for any given time you're outdoors, you're getting some protection as opposed to not having any protection. It's really important to look at it that way. It's not that, I've got an SPF of 50. If I'm outdoors for 5 minutes, I can now be on outdoors for 50 minutes. That's not the case. That's the time that it's going to take for you to burn, which is not what we want to have. That burning process is what we want to avoid. And we know that from all the studies that burning leads to skin issues, basically. So I would say the higher the better, because you're more likely by the time you spread it on the skin to get appropriate cover. And nothing beats staying out in the shade, having a hat, wearing appropriate clothing. But we've all been on those lovely sunny holidays where we're basking in the sun. But now we know that we need to be really careful and just be mindful of how long we spend outdoors.
And it's not, I think sometimes people get the notion that as dermatologists, we all want people to stay indoors and in the shade all the time and be totally vitamin D deficient. I mean, that's really not it. We love the sun too, I mean, I got married in Mallorca in July and I'm Irish. I absolutely love the sun. I was a bit of a sun worshipper in my 20s before I got some sense being a dermatologist. It's just we are trying to get people to be sensible and give them the tips to go out there and enjoy the sun and be healthy and be outdoors. And we know that having an outdoors lifestyle is so good for you for so many reasons, and stress, reducing your blood pressure, all of that. We're not being zealots. The reason we're saying, because sometimes people will say, well, SPF 50, that's too high. That's, you're being a zealot. It's not. It's because we know that really, even though you're putting that SPF 50 on, you're still getting a lot of UVA and UVB.
Absolutely.
If you're going to be outside enjoying yourself, which we want you to do.
And if you're outdoors walking on the beach, just pop a T-shirt on. May not be as fun as not having that, but just be more mindful of certain clothing.
Yes, the clothing. This is one of my, I don't know if I've had this conversation with you before, Angela, one of my major gripes about SPF clothing for kids, the sun protective clothing. If you Google sun protective clothing for kids, inevitably you get these really cute little kind of T-shirts with a long sleeve and short shorts for the girls. You know, it's
And for the boys,
rarely,
yeah.
and for the boys. But, you know, oftentimes more for the girls because they look really cute. I've actually gone to the point where I've emailed some of the companies about it, saying I got no response. But it drives me mad because they, you know, and as a parent, you know, parents would think that they're doing a really good job, you know, getting some protective clothing for their kids and maybe not realising that the short shorts need to be,
A little
you know,
longer.
long.
Yeah.
Because actually, especially, well, with girls, we know that melanomas in women tend to be on the legs.
Yeah, absolutely.
That's where they get them.
But I must say, my boys wear the clothing. They love being on the beach making sandcastles, and I can get a top and shorts.
Yeah.
They like their baggy shorts to run in and out of the water. Not a hat so much. That's always a little bit tricky.
Yeah.
But clothing for sure. And we know that melanomas tend to occur in backs.
For boys. When they're younger, I managed to get them. I've got these great pictures of them all wearing their big hats and their long suits
Brilliant.
and everything. And now as they're getting older, like my tween is now like, I want a bikini, Mum. So, yeah, so that we're going to have to broach that one soon.
Brilliant. Well, thank you so much for that, ladies. And Angela, if people want to find you, where do they find you?
So I'm at the Lister. So I'm at 102 Sydney Street. And on Tuesdays, so I'd be delighted to see them.
And anything to do with skin, hair and nails.
Exactly. Anything to do with skin, hair and nails and paediatric dermatology.
Yes, fabulous.
Brilliant. Thank you both very much.
Thank you.